what I'm going to do is go through the skull and talk about the different cavities, the fossae, which are depressions, some of the sinuses, but not a whole lot because I don't have that model up here in front of me. Okay, and then of course all of the cranial bones and the facial bones. So the skull is pretty much the most complex structure in terms of all of the bones in the body. And we're going to start with the cavities. So you have an oral cavity, which is the mouth. Okay, it's also called the buccal cavity. You have orbits. These are cavities as well for the eyes. And you have a nasal cavity, okay, for the nose. The largest cavity is the cranial cavity, which encloses the brain. Okay, so the brain would fill in all of this space. This large cavity is split into fossae, which are depressions. And you can see where it dips down a little bit here. So this is the anterior fossa, the middle fossa, and the posterior fossa. And so there's different portions of the brain that sit in each of these parts. The major cranial bones. So the one that's most obvious that you see initially is the frontal bone. The frontal bone is associated with these ridges called the supraorbital margin. So this is where your eyebrows would be located. The frontal bone is separated from the parietal bones by the coronal suture. A suture is a joint. It's flexible when we're children as your brain is growing and the skull bones are growing, but as we enter into adulthood and later in life, these begin to fuse and they're a lot less flexible. The coronal suture separates the frontal bone from the parietal bones. So these are on lateral sides, and what divides the two of those are the sagittal suture. Parietal bones are separated from the temporal bone via the squamous suture, okay, on both sides. And it is separated from the occipital bone, which is posterior, by the lambdoid suture. The temporal bone has a lot of features to it, and we're just going to point out a couple of those. This is the mastoid process right here, and you can take your fingers and palpate behind your ear and feel that bone, that bony projection. The point is called a styloid process, kind of like a stylus that you would use on a computer, how it's pointy. There's a hole that allows for entry into the ear canal. This is the external acoustic meatus. And it has a process. This is a projection, so where the bone projects out and potentially connects with another bone. In this case, it connects to the zygomatic bone. If we open this up and we look at the inside, we can see the temporal bone in here as well. This little mountain is associated with the temporal bone, and inside this bony structure are two cavities. This is where the inner ear cavity would be and the middle ear cavity. So where the nerves are held and where those very small auditory ossicles are located. Around this structure are some holes. And so sometimes I like to tell a little story in order to help remember what the holes are and where they're located. So there's two holes that are quite medial that enter into this space, and then they go down, and that allows for the carotid canal. So I can hide out in the carotid canal and then make my way up and over the mountain and sit in the internal acoustic meatus. So this is where the nerve comes out from the inner ear and it goes to the brain. If I come out of the inner internal acoustic meatus and I slide down the mountain, I'm liable to slide right down into this hole, which is the jugular foramen. Okay, so we've got a couple of holes. The carotid canal, which kind of goes into the bone sideways, and then it makes its way down here. That's for the carotid artery, so that brings blood to the brain. Go up and over the mountain, sit in the internal acoustic meatus before finally sliding down into the jugular foramen. Okay, now I want to look at the occipital bone. So this is posterior, and it makes up a large portion of the base of the skull. This has some lines to it. They're called nuchal lines, so neck, nuchal. These are lines where muscles from the neck attach, okay? So when you're moving your head back and forth like that, the muscles are pulling on your skull, okay? And so the muscles are attached here and here. In the middle of one of the nuchal lines, you'll see a bony protuberance. So it's a bump, and you have felt this bump before if you've gone to the salon and you've had your head in the shampoo bowl and you come away from it thinking, oh my gosh, that really hurts. Well, that is the occipital protuberance that was resting on the shampoo bowl. Further down, we've got this really large hole here. This is the foramen magnum. So foramen is whole, singular, and magnum means really large, okay? On either side of the hole, we have these smooth surfaces. They're rounded. These are called the occipital condyles, and the condyles are where the skull will make an articulation with the vertebral column. On the inside of the foramen magnum, we got two tiny holes called the hypoglossal foramina, and that is for a nerve that innervates the bottom of the tongue. Okay, let's see what else we need to look at. On the inside, I'm going to look at the sphenoid and the ethmoid bone. So the sphenoid bone is shaped like a bat or a butterfly, and it makes up a portion of the cranial floor. So it would be right there. We explode it out and have a look at it. It's got two wings, so it has lesser wings, these little tiny spikes, and then these are the greater wings, okay, those bony structures. And it has a saddle. So this structure right here allows for the pituitary gland to sit right there, and there's a back portion to that saddle. So this whole structure is called the sella turcica. And there are a couple of holes, and these are called the optic canals. Okay, so another story I like to tell. Imagine a little fairy is flying this thing, sitting in the sella turcica and holding on to the optic nerves in order to steer it. So that just, you know, little fun stories like that help us to remember things. Okay. The ethmoid bone also makes up a very, very small portion of the cranial floor, hardly anything at all. And if we explode it out, then we can see this a little better. We've got this bony projection right here, which is called the crista galli. This attaches to the membranes that surround the brain. Then we have this flattened area right here, which is called the cribriform plate. And in the plate, there's a whole bunch of little tiny holes, or foramina. And so you've got a nerve that sits right up here, and nerve endings that penetrate right down through those holes. And that's for your sense of smell. Other parts that make up the ethmoid bone are the superior concha. Concha is singular, conchae is plural. So you see that on here, but you can't see it looking straight up into the nose. It's difficult to see. But you do see the middle conchae. Okay, the superior would be way up there. And another bone, but it's not associated with the ethmoid bone, but it's called a concha as well, is the inferior concha. So that's these little projections into the nasal cavity down here. In the nasal cavity, since we're here, part of this divider is actually a part of the ethmoid bone. It extends down to separate the two sides of the nasal cavity, and it's called the perpendicular plate. It joins with a bone right here, which is called the vomer. So then we have a septum. If someone has a deviated septum, then it's not directly in the middle, it's over to one side or the other. And I think that takes us to the facial bones. So looking at the face, right here and right here, all of this and the top part of the jaw, all of that are the maxillary bones. So within the maxilla, there are air spaces. So within here, I would find the maxillary sinuses. The maxilla have sockets or holes for holding the teeth, and those are called alveoli, plural, alveolus, singular. So one tooth is attached to the maxilla at the alveolus. Your hard palate is made up mostly of the maxillary bones. You have a dividing line that goes right down the center of those bones. That's where they fuse together, and it's called the intermaxillary suture. And a very small part of the bony palate is made up of these two tiny bones called palatine bones, and that suture also goes through them. Out to the side of the maxillary bones are the zygomatic bones. So these are your cheekbones, and the cheekbones form an arch. And there's our arch right there. There's actually two bones that make up this arch, the zygomatic bone and the temporal bone, because you can see the projection from the temporal bone and the projection from the zygomatic bone and how they come together to form that cheekbone right there. Nasal bones, those are pretty intuitive. They're up here at the top of the nose. They're rather small. And the smallest bone of the skull is the lacrimal bone. So that's right here, the corner of the eye, and it has a little tiny depression in it called the lacrimal fossa. That's where there is a membranous sac that sits and it collects tears. The last part of the facial bones is the mandible. The main part of the mandible is this right here, and it's called the body. The body stops at the angle. So here's your angle, and then it branches. The branching is the ramus. So this whole thing right here is the ramus. And we have two projections that come off of here. This is the coronoid process. Process is projection. And then you have the mandibular process. And it's capped by a condyle. So mandibular condyles right here. So it's a smooth surface. And that fits into the mandibular fossa located at the temporal bone. So that's where your joint would be, okay, where it articulates and allows for mobility. The mandible also has teeth, so it's also going to have alveoli, tooth sockets. On many of the models and on the humans, you've got bumps here, which are called the mentalis, or the mental protuberance. This one is not super distinct here, but mental means chin. Okay, so you would find those on here. Okay, that's all for this.